can hear me. I feel that I'm following a lot of experts, and I'm really not an expert. I am a practice manager who's sort of jack of all trades, I guess you could say. At our surgery in Adelaide Street, which is in Blackpool, we decided to start a virtual PPG. How it began is we realised we did have quite a healthy PPG who were engaging in our face-to-face meetings, but they were all of one type of people. We tended to have all the white British people who are relatively healthy and retired, and I found that right across the board that tends to be the case with most face-to-face PPGs. We wanted a bit of a more diverse group. We wanted to know what our other patients actually felt about the surgery. We're in the middle at the moment of merging, we're in the middle of building a new build, and I wanted to gather information from all of our patients on what they wanted to know, what they're interested in, and what their thoughts were on everything. So we needed to reach more people. We needed to get help. Frankly, I had no clue on how to run anything like this. We did have a very successful Facebook page. We've probably got sort of 200 people that roughly come onto our Facebook page on quite a regular basis and comment and upload various things, and generally good comments. I don't think I've had too much bad stuff to answer, so we felt that we were actually doing okay with that. But we wanted to attract more people in to get this whole PPG running as a closed PPG group. I went to Ben Greenwood, who works for the CSU, and he came in just to talk to us about our Facebook page and if we could do anything to improve that, and he was pretty happy with that. So he decided that we should have the birth, as he put it, of the virtual PPG, and he would help us set that up and work with that. So we started by advertising. We advertised on our Facebook page, our website, in the surgery. We made some posters that we put up, and I basically got all my reception staff talking, chatting to the patients and asking them if they were interested in joining along with this, because it was something that they didn't have to turn up to. They could sit in their lounge and press a button and ask questions. So we did plan our first meeting. Now I know there are a few virtual groups that have gone on in the country, but what I was told, I was actually advised to do it as a separate group. And I chose not to. I felt that if I went to my face-to-face group and said I've got a different group of people and you're not necessarily part of that, they would be upset. So I wanted to do a joint meeting side by side so that we could gather the comments from the people sat in front of me and the comments from people that were at home, work, wherever else they were commenting from, and bring them together so we could all talk and discuss within one meeting exactly what was going on with the practice. This is Adam. Adam is my sort of, he's part of my admin group, but he's also the greatest help for me with this, because I couldn't possibly talk to everyone face to face whilst typing without appearing rude and not really engaging with things. So as I was talking to the face-to-face PPG, he would then be typing up everything I said. They would then be coming back and answering questions, and he would then read out their responses to my face-to-face group, who would then comment back. He can multitask, thankfully, so he's assisted a lot with that. So as I said, we updated the group, and this also gave a chance for our doctors and some of my staff to get involved. I've got staff that wouldn't want to spend their evening sat at a PPG group when they've worked all day. But again, they started to make a few comments, and I think mainly people were really pleased to see doctors on there who were actually giving them the answers they wanted. I think the only issues we've had, a few people asking personal medical questions, which we've had to put a stop to. Can't have that all over Facebook. We have also had people that have crossed the slight line and thought that perhaps they could start sending personal Facebook requests to members of staff, because we were all friends now. But that's probably been the only downside of everything, and that's been sorted out pretty quickly. In the first one we had 67 comments, which I didn't think was too bad for a first attempt. It's probably about 15 people that actually came on board and signed up that day. We then got published an article in Management in Practice about the virtual PPG, which I felt then would encourage other people to maybe do that, and I have had people who have then found me from practices on NHS Net and sent me an email and asked me how we went about this. So I felt I have helped to encourage other groups to work with this. Well, it says next meeting planned. It was actually last night. We held our second virtual PPG group last night alongside our face-to-face group. It did go very well. We have had 3 new members this week, and I didn't have it in time for this, it happened last night, but I wrote down the final comment, which shows that this is working to me, because this was a young man who none of us knew, wasn't recognisable to any of us because he was probably quite healthy, so he didn't actually come to surgery. And he had put, "Thank you all, this has been really good. I normally only experience the practice just attending the occasional appointment. This has been a really great experience." So I felt that that's made it all worthwhile, that people are actually getting on board with this and really enjoying sort of being able to be part of things without actually turning up. Thank you.